Good day to each and everyone. I'm Fatmawati Afyon and I'm going to demonstrate the physical assessment on how to perform it very well. So first, in taking the health history, we need to start your assessment by taking a detailed health history to obtain the subjective data to the patient. The information you gather during the interview will provide the insight of the patient to actual or potential health problems and guide you by the physical assessment. In taking vital sign, we need to ensure that we wash our hands by the use of the proper hand washing and after washing your hands, provide the equipments that needed for the demonstration. So these are those equipments needed to taking the physical assessment to the patient. In taking vital sign, we need to use the four basic techniques of getting the physical assessment: the inspection, palpations, and percussion and auscultation. This will help to determine the process of the health status of the patient. So, ma'am, good morning, ma'am. I'm Fatmawati Ayapian, your nurse in charge for today. So, I'm going to take your physical assessment for this day. So, ma'am, can I ask you something? Do you smoke?
No.
Then, note the patient's list of consciousness, including his degree or weakness and orientation to person, place at a time. After obtaining the health history of the patient, ask the patient to empty his bladder and provide an urine specimen if needed, and then to completely and put on a gown. I'm going to take her vital signs. After 1 full minute, this the vital sign. Roll the sleeves of the patients. Ensure that 2 fingers are inserted in the BP cuff. After getting the vital sign, first we're going to assess the patient's from head to face and inspect the head to face should be in a normal shape, size, or symmetry and contour. After getting the vital signs, we need to assess the patient's from head to face so that the inspect of the head to face will occur that if the face was normal in size, shape, symmetry, or contour. Look at the patient's hair if it's oily and should not contain scales or meats. The hair should not be extremely dry or oily. Next, palpation. palpate the patient's scalp in the forehead, in which should be pink, mobile, and free of lesions. You may feel bony prominences in the forehead, in the side of the parietal bones, and behind the ears, and using the normal palpation. Using the tips of middle finger and index finger, palpate the temporal arteries. Their palpation should feel equal. Then, listen for bruise over the temporal arteries. You should not hear any. Next, press your thumbs under the zygomatic bones to palpate the maxillary sinus. Then lightly percuss these areas. Palpating and percussing the sinus should not cause pain or tenderness. If they do assess the sinus further will transcilium interaction. Move your fingers to the patient's temporal mandibular joints as you palpate with your middle finger. Instruct the patient to open and close his mouth. Open and close, mom. Close. Then the joint should be not have freely and painlessly. The test facial muscles, the motor portion of the facial and trigeminal nerves, have the patient raise and lower his eyebrows, bare his teeth. Smile movement should be symmetrical. If the patient reports problems with his sense of taste during the health history, interview the patient to test the sensory portion of the facial nerve by having the identify sweet, sour, bitter, and salty substances. This is salt. Is it salty, ma'am? Yes. Salt to assess the patient's bisensory portion, the trigeminal nerve will. Testing the patient's the ability to identify the simple touch of his or her skin, instinct him to close her eyes and tell the patient the moment it feels something or touching his skin by in the cheeks or simple touch sensation both sides of the patient's forehead, cheeks, and jaws.
Left temporal, right temporal, left cheek, right cheek, jaw.
The patient should feel equally of the sensations on other sides of his or her face.